Good afternoon. I'm Lori Atkins Holiday with the Literacy Cooperative, and we are so glad that you're here to join us for supporting youth behavioral health and key issues, strategies, and referral pathways. We're very pleased to have Ohio Guidestone staff leading this discussion today, and we're so glad that you could join us. This presentation is a peer-to-peer learning that was provided through the 2Gen Collaborative Network, which Keisha is the lead part of the peer-to-peer and professional development action team. So a lot of this has to do with her efforts. So thank you, Keisha, and the rest of the group that might be attending on this session. I'm going to introduce you to the speakers, and then I'm going to turn it right over to them. Um, as I said, they are from Ohio Guidestone. Catherine Gasper is an early childhood mental health therapist at Ohio Guidestone. For the past 9 years, she's worked as a therapist specializing in providing both individual and family therapy to children birth to 6 years old. She has an ECMH credential, is a child parent psychotherapy therapist, and has been accredited in Triple P, which was last month's session. So thank you. Kaylin Schaefer is a licensed independent social worker with supervision designation. Those are very highly sought out when somebody is trying to get their LISW, so that's great. She is the Assistant Director of Community Counseling at Ohio Guidestone, and she has 15 years of experience in youth behavioral health field. Her specialty is in infant and early childhood mental health. And she also has a certification in Triple P levels 2, 3, and 4. So welcome to both of you. And I'm going to just tell you, if you do have a question, there will be stopping points where they will ask you to raise your hand, and they will be glad to answer any questions. If you feel more comfortable putting it into chat, you can do that at any time. And at the next stopping point, they will answer those questions. So I am going to go ahead and turn it over to Catherine. Thank you.
Hello. I am excited to be meeting with everyone today, and I think we're just going to jump right in. Thank you for joining us for supporting youth behavioral health, and we will be discussing key issues, strategies, and how to refer families you might be working. These is the objectives of today's meeting. We're going to overview common behavioral health issues in young children, adolescents, and we'll talk about strategies on how to help families cope with these, how to address any type of behavioral health concerns with parents or caregivers, how you can refer and what resources are out there. And then we're going to talk a little bit about Ohio Guidestone and how we can support the families that you're working with. So I wanted to start off with kind of a discussion about how prevalent mental health is in the communities that we serve. If you look at this diagram, this is data taken from the CDC, and this is data from 2018 to 2019. So if you look at this, the three most common behavioral health conditions diagnosed in children were anxiety, depression, and then behavior disorders is kind of a catch-all for conditions including ADHD, conduct disorder, ODD, which is oppositional defiant disorder. So that's like a catch-all kind of category. And we see just in general that the prevalence of these conditions increases with age. So we have the highest category, the green category, the 12 to 17. And in general, there's a higher prevalence at that age group, but it's still very prevalent with early childhood. They mark ages 3 to 5 and ages 6 to 11. Is there any kind of questions about this before I keep discussing this?
Yes, can you give us some symptoms that we might see
Mm-hmm.
that indicate what was that?
Yes.
Three to
So
six.
I'm gonna talk, Keisha, if that's in a slide or two, if I could just say wait 1 second and I'll get to that. I just wanted to say one or two more things. The data represented in the chart on the previous slide, an average 1 in 7 children ages 3 to 17 was diagnosed with a mental health or behavior condition. And in that same time period, 2018 to 2019, 1 in 3 children had one or more, like 2 or more conditions diagnosed. So there are lots of conditions that go together. So Kaylin, if you want to, so common behavioral health issues, a lot of diagnoses that you're going to see in young children are anxiety, depression, grief-related disorders, sensory processing disorders, autism spectrum disorder, and post-traumatic stress. One thing that I want to point out is that these conditions can all exist by themselves or in combination with another. So we often think of sensory processing as a symptom of autism, but it is a condition that exists in of itself. And so you don't have to have autism to have sensory processing conditions, and you don't need to have if you have sensory processing conditions, it doesn't mean you have autism. And so these are common diagnoses in children. One thing I also wanted to point out is that despite these being relatively common in children under 6, there is data that suggests that only half of children who are diagnosed with a mental health condition are actually getting either mental health services. So that could be therapy or that could be medication management from a psychiatrist. So when we look across youth in general, that's, ages 3 to 17. So you have a really important kind of role. If you know a child that you're working with has symptoms or has one of these conditions, the parent mentions it to you, asking them, are you getting services? What do you have to help your family with this is really important, because we want to bring that number up. We want as many children as possible to have access to treatment. Okay. These are common conditions that so children over 6 might be diagnosed with. So you have anxiety, depression, you have eating disorders, grief disorders again, attachment-related concerns, autism, sensory processing, post-traumatic stress. You're going to see, as children get older, more diagnoses of behavior and conduct disorder. So more of that ODD, the oppositional defiant disorder, conduct disorder, ADHD, and attention deficit disorder. So you're going to see the prevalence of those increase as children get older. Any other questions before I go on? Okay. So this slide is extremely important, and I wanted to discuss it before I start talking about symptoms, which was Keisha's question. So I know you're waiting, Keisha, but I will get to it. So maybe everyone could just put like a hand raise or a thumb up if you've ever heard of ACEs. Has anyone ever heard of the ACEs? Okay. I'm seeing a couple hands up. Okay. So this is incredibly important when we're talking about youth mental health. ACEs, for those of you who don't know, are adverse childhood experiences. These are potentially traumatic experiences that occur in childhood. And these can be abuse and neglect. So this could be physical abuse, emotional abuse, sexual abuse of a child. This could be neglect. So not having their basic needs met, not having enough food, having a parent say incredibly hurtful things like, I wish you were never born, or cursing out the child repeatedly. So we have on one sphere of an ACEs are the abuse and neglect. And then on the other side of that is the household dysfunction. So these things are things that maybe we don't think about when we think about all the struggles that children might be going through. This can be having someone in the home, especially a caregiver, having mental illness, divorce or separation. It could be witnessing domestic violence, having a parent who is separated and maybe, overseas because they're in the military. It could be having a parent incarcerated or a parent who abuses alcohol or drugs. So all of these factors are going to impact the mental health of a child. Any questions on this before I keep talking about some of the statistics of ACEs? No. Okay. Some of the ones that we don't have a picture for, but that are really impactful is like chronic poverty and discrimination can also have a significant factor on a child's mental health. And those are things that we have very little control over. They're a part of kind of society and how families interact in society, but those can have an impact on mental health as well. And what we know from research, and this is research that has been really well published in many studies and is easily available through the CDC, but ACEs are incredibly common. By adulthood, 64% of adults have reported that they have experienced at least one ACEs score before the age of 18. So that means adults are reporting that before they turned 18, at least one of these things happened to them. That's 64% of all adults. And then this is even more staggering, but nearly 1 in 6, so that's about 17.5% of adults reported that they experienced 4 or more of these in their childhood. So these are very, very profound and have an impact on a lot of people. And these are tied to, feelings of anxiety and depression, trauma, and they are related to kind of just overall mental health functioning and have been linked to feelings of isolation and thoughts of self-harm and suicide. So this just has a wide impact on the functioning of children and youth. So this is what Keisha was talking about. So these are symptoms that you might see in early childhood. So when we refer to early childhood, we're generally talking about children 6 and under. And the most important thing I want you to take away is that all behavior has meaning. And so you're seeing a list of common behavior. So you might see a loss of developmental skills. So a child was talking and now they stop. That's a very common one. You might see that they have excessive or dangerous tantrums where they put themselves at risk or someone else. They could be aggressive, hitting, biting, punching, kicking other people, throwing objects. You might see a really persistent and irritable mood. Or children may seem fearful and anxious. They might not want to be away from you. They might talk about their body hurting, their stomach hurting, their head hurting, and there's nothing wrong with them. They're perfectly healthy, but they're talking about having this pain. It might look like having an extreme amount of difficulty when a caregiver leaves the room or a child's left at a child care setting or school. They might have trouble sitting still. And young children, they're really not meant to sit still for a very long period of time. It's normal for them to be somewhat impulsive and hyperactive, but you want to look to see if it's like extreme. So are these behaviors putting them at risk, putting them in dangerous situations? Are they so impulsive they're running into traffic and at risk of getting hit by a car? And it's also, I get this question a lot. It's completely normal for a young child, especially under 6, to only focus on something they really like to do, or on TV or a tablet, something that's really stimulating and engaging. That is rather typical. And as a general rule, like in early childhood, being able to focus on something for a couple minutes is what we're looking for. Um, Any questions about what these symptoms might look like? Keisha, you have your hand raised.
Uh, well, maybe you're getting into this one, but
Mm-hmm.
like, what are some best de-escalation techniques when
Mm-hmm.
we are working with families and kiddos who exhibit some of these traits?
Mm-hmm. So that's a really good question. I'll briefly discuss it now, but we'll have some opportunity to discuss that more in depth. Um, so one of the biggest things is like I said, behavior has meaning. So investigating and paying attention to what in the environment might be contributing to these behaviors. Um, so, for example, I had a child I was working with, and everyone thought they were impulsive and hyperactive, and they were having trouble sitting down for circle time. And they weren't really struggling with this difficulty with moving at other times of the day. So we really looked at circle time, and we learned that it was more a social anxiety situation. They were really uncomfortable with all the kids, how loud it was, and just interacting in a large group. And they were trying to get away. They were trying to leave circle time because it was uncomfortable. Um, and when adults would stop them, they became angry and aggressive because they didn't know what to do. So, in looking at the environment, um, responding with empathy. So it's, you want to acknowledge a child's feelings. I understand you're angry right now. Your body is, it label what you see their body doing. And then once the child feels like understood and heard, then you can review a limit and a boundary or a rule. Um, so first starting with empathy, and then reiterating the rule and talking about what we're going to do differently next time, what the expectation is. Those are some good strategies. Um, Kids, especially young children, have very limited insight into their symptoms. They really need an adult involved. So one of the best things you can do is encourage the adults in the children's lives who you're working with to be actively involved in their mental health and their treatment. Um, they they need that support to make change. Um, in this slide, there's some additional symptoms, changing in eating habits, sudden changes in weight gain, um, not spending time with family or friends, not playing with others, having accidents after being fully potty trained, bad dreams. Those are all symptoms that you might want to monitor and may require evaluation. Keisha, did I kind of answer your question? Okay. Any other questions? So when we're talking about teens and youth, they have a lot of the same symptoms um, as younger children, but there are some that you're going to see, they're going to look differently. So as kids get older, you might see negative self-talk or statements. I hate myself. I'm ugly. I can't do it. You might see like extreme fatigue or tiredness, lack of motivation to do things like shower and do their homework. They might have hygiene concerns. They might avoid extracurricular activities that they really liked or have trouble getting homework done. As children age and they have more stressors put on them and they're their capacity might reach the limit and they might start having these symptoms when before, when they were maybe a little younger, they weren't as prevalent or not as seen as much. Kaylin, can you switch to the next page? So there are some that we see that are more common. So as children age, bullying and the inappropriate use of technology are ones that I want to highlight. I have seen this in my practice explode after the pandemic. Schools gave everyone access tablets and technology, and there's a sense of anonymity when you can say mean things or bully someone over the internet. And we see kids, engaging maybe in sexting or other activities that are seem less severe when they can do it behind a screen. So those are things to be looking out for. Self-harm. This can exist in early childhood. In early childhood, this might look like headbanging, biting themselves, scratching themselves. And as children age, this could become more severe. This could becoming burning themselves, cutting themselves. So you want to look at how that might change based on the child's age. Using alcohol and drugs, smoking tobacco, and restricting food intake, exercising way too much than is healthy to lose weight, getting into physical fights, binge eating, vomiting to lose weight. And then you start seeing, truancy, theft, involved in the criminal justice system. All of those will increase as children age. Is there any questions or thoughts on those? Okay. This is a really important, these considerations. You always want to look at the frequency, duration, and severity of the symptoms a child is presenting with. And you want to think about healthy development versus a mental health concern. So, for a young child who might be 1 or 2, we're not going to expect them to cooperatively play with other children. But a child who's in, first grade or second grade, they should be able to take turns, play a game like Candyland, and not have, many issues. If someone experiences the death of a family member, being sad and having a depressed mood, crying, the duration of that, if that happens for a few weeks after the death, that's typical. That's a healthy response to the death of a loved one. If that persists for months and it gets worse, then we'd be more concerned about that. The severity of the symptoms. Are they causing harm to themselves? Are they getting involved with the justice system? Is it a safety concern? And the frequency, how often? So a toddler is going to tantrum. Do they tantrum and it lasts about 5 minutes? Or are these tantrums lasting 30 minutes plus? Those are kind of the spectrum we're looking at to determine whether or not something is a typical behavior or a mental health concern. And just because a child is a difficult child doesn't mean they have a mental health concern. Children will test limits, they will push buttons, but are they doing that in a way that is safe, or is it causing distress to their relationships or their functioning at school or home? All right. These are red flags. So if any of these happen or you're made aware of them, these are things that are probably going to require intervention immediately. So referring right away to services. And these include, a child reports that they're being abused or neglected. You become aware they're engaging in inappropriate sexual activities, or in a young child, they know too much about sex. They're having irrational thoughts, delusions, or hallucinations. So they're hearing things that aren't there, talking about things that really aren't accurate, like concerns that someone is watching them or poisoning them when none of that is happening. And any type of self-harm or substance abuse would be cause for immediate concern. Any questions? Okay. So why is it important to intervene? These are two of my favorite quotes. Addressing mental health issues in young children builds healthy adults. 0 to 3 said that. And they are a great resource to families regarding typical development and development for the early childhood population. And then Frederick Douglass said, it is easier to build strong children than to repair broken adults. And this is very true. From birth to 3, there's approximately 1 million neural connections made each second. 90% of the brain development is completed by age 5. Now, that is quite, like, that's a critical period. This means that the brain, even though it continues to develop until the mid-20s and can change well into adulthood, it is much easier for the brain to change and at a young age. And so intervening early intervention has a profound impact on someone's ability to function later in life. So getting support as soon as symptoms are present, so we have that time to work, is incredibly important. Young children in particular, because their brains are changing so fast, this does make them vulnerable. They are more susceptible to the impacts of ACEs and some of the other traumas and toxic stresses that are out there. But it's also a flip side to that, and that's that their brains are very resilient and can adapt. And so we need to give them the tools as soon as possible so that they can have better long-term mental health outcomes. So here's a little bit more on the strategies. So co-regulation is really important. Co-regulation is using someone else to calm down. And even as adults, we use co-regulation. I called my best friend when I was driving to work this morning because I was pretty irritated at something my husband did last night, and I needed to talk about it. That's co-regulation. When you as an adult need a hug and someone gives it to you, that's co-regulation. So we need to remember that even as adults, we need that. And we need to make sure that we're giving it to children of all ages because it is normal. It is normal to need someone else to calm down and to relax. We have to master co-regulation before we can use self-regulation, which is calming down by yourself. That being said, sometimes you're still going to need someone else. So practicing co-regulation, normalizing that for the families that you work with. Yes, everyone wants, a child to calm down by themselves, but sometimes they're going to need you. And ask the families, what can you do? Is that cuddling on the couch? Is that talking about our day? Is that going for a walk together? What is your family going to do to help each other regulate? Building joyful connections and experiences. So there's a lot of science behind this, but when you play with when you play together, so as a child that might look like building blocks on the ground, and as a teenager that might be reading together, playing a video game together. When you have kind of authentic experiences of connection, your body releases hormones like oxytocin that make you happy, and it can really help prevent like stress response. So it's important to facilitate those connections. As a provider, someone who might be working with families, you have clear expectations around scheduling and keeping appointments and rules, and you model that because parents need to have that for their children. They need to have structure and routines, rules. So that's a way you can help your families have positive mental health outcomes. Participating in parenting groups, the triple P parenting groups, nurturing parenting, All of those are wonderful resources for families. Even like support groups. There are support groups for families with, children with autism, or working with a child who has ADHD, and connecting families to those can be really beneficial. Um, but the biggest thing is, like I said, early intervention. As soon as there's an area of concern, don't wait. Help your families connect to services. That could be therapy, psychiatry, developmental testing. You can refer your families to their pediatrician, or a Bright Beginnings and Help Me Grow worker, and those professionals can help connect to resources as well. And school districts, getting children, evaluated for an IEP, a behavior intervention plan, a 504 plan, all of those things can benefit the children that you work with. Um, and on here we have like emergency help. So if it's a crisis, if someone is in danger of hurting themselves or someone else, call 911. You can call a crisis line. We have the Ohio Guidestone crisis line issued here. There's also a national crisis line and 988, which anyone can call to be linked towards help. One of the big barriers to referring is stigma. So parents and children don't want to be judged for the struggles that they have. They may have had a bad experience with one provider. So you talking to your families about this, like, is there something that's going to stop you from accepting a referral? What are your concerns if we ask for help? And having those conversations with the families that you work with. Keisha and I are working with a family right now, and they were really hesitant to accept services. They had a really bad interaction with another provider, and Keisha and Demetria introduced me to the parent. I attended like community events. The parent got to know me, and then they accepted the referral for support. And so figuring out maybe what those barriers are and helping address them if you can. And sometimes that means getting the parent mental health services so that they can then be a little more stable so they can help their child. These are 5 protective factors. So this is social and emotional competence, knowledge of parenting and child development, resiliency, concrete support, and social connections. This is like the foundation of the family partners work that I do with Keisha and Demetria. And we know that if we meet these areas of needs in a family, they're going to have better long-term outcomes. If the families have their basic needs met, they can focus on social, emotional, and mental health issues. If parents know what's appropriate and what's not, they know when to ask for help. And parents and families who have connections, social connections with their community, are less stressed, have better health outcomes, and are more resilient. And so these are very important. I was working with a family, and none of the children had beds, and mom was at risk of losing her job because she couldn't drive. She had a suspended license. And so before we could even really tackle the mental health concerns of the children, we had to make sure everyone had a bed so they could sleep comfortably at night. And we had to make sure that mom could transport her children and go to work without the risk of further court involvement. And so we addressed those concrete needs, and then we were able to address the mental health concerns. So that's very important. Any questions about anything that we've discussed so far? All right. As we've stated before, the 2-gen approach is vital. Winnicott, he was a pediatrician and psychoanalyst, and he was quoted as saying, "There is no such thing as a baby. There is a baby in someone else." And basically what he meant is that no child is an island. They exist within their family system, and often other systems like the education system or the medical system. And these systems impact a child's functioning. So to be effective, we really need to do family work. I'm a part of the Family Partners group, which is a collaboration between Spark Family Connections and Ohio Guidestone, and we work in the central neighborhood. And we really, in our work together, emphasize this. Anyone enrolled in Spark, their sibling or their parent can get mental health services through me, and we model those services on the 5 protective factors so we can help meet emergency and basic needs and all the family's needs to improve long-term outcome. So any questions about this? All right. Thank you. I'm going to turn it over to Kaylin.
All right, I'm taking over. Good afternoon. I'm going to talk a little bit about what we do here at Ohio Guidestone and how we can help with all of the symptoms and concerns that Catherine mentioned. So we here at Ohio Guidestone are a leader in community behavioral health services. We provide a continuum of prevention services and mental health and substance use treatment, focusing on responsive person-centered care to approximately 26,000 people each year through telehealth and locations across the state. We provide services in 39 counties throughout the state of Ohio. With compassion and respect, Ohio Guidestone helps people across the lifespan navigate the most difficult times of their lives, focusing on the needs of the whole person and empowering them to take steps towards a healthier future. We were founded in 1864, which makes us over 160 years old. I'm not a math person. We were founded as a German Methodist orphanage for children during the Civil War. So we have grown and changed and progressed a ton since then. We were known as Berea Children's Home and Family Services. So those of you who have been around for a while who are local to the area will for sure have heard of that. And we became Ohio Guidestone in the 2000s because we outgrew our name. We were more than just Berea. So we've adapted to changing needs of society with a growing footprint across the state of Ohio. But we've always been focused on better person-centered care and treating the whole person with compassion and respect. So as I said before, here is sort of our reach over the state in 39 counties. We offer a wide array of mental health services and substance use disorder services. It's a little bit different per county. So if you have questions about services in different counties, I recommend going to our website to check it out, and also contacting our intake line to ask what might be available in different areas. We have 3 outpatient counseling offices. Each office serves youth, adults, and families. They are located, there's one in Euclid, there's one in Lakewood, and there's one in Berea. The Euclid office and the Berea office both have urgent care services, which means folks can walk right in and get assessments. We also have psychiatry at our Berea location, and we have psychiatry at our Carnegie location, which is not an outpatient office, but we just have the psychiatry facility. So in terms of what we're talking about today, our youth behavioral health services are robust. We have an early childhood mental health program servicing kids from 0 to 6. We provide mental health assessments. We also have consultations, so we get a lot of referrals from everyone. Sometimes the referrals will say like, behavioral issues, wondering about developmental concerns. Is this typical? Things like that. So we can actually come in and determine, do they need a mental health assessment or do they just need a referral somewhere else? So they don't have to necessarily have a mental health concern in order to come in as a consultation client. They get an individualized treatment plan. So we work together with the families that we serve in order to develop goals and methods in order to figure out how we're going to work together to improve the lives of the children and families that we serve. We provide family and individual psychotherapy, therapeutic behavioral services. We have quite a few therapists who are registered in child parent psychotherapy, which is an evidence-based trauma service. We also provide child care classroom intervention program. So this is services within childcare centers, preschools, and home-based school providers, where if there's a child who's at risk of expulsion, or if there's a whole classroom who is in need of some assistance with behavioral management support, we're able to go in and provide that service to the teachers and to the children in the center. We have also with our community-based services, we provide services from 6 to 18 as well, which are very similar to our early childhood services. We see clients wherever they are. We truly meet them where they're at in terms of, we go to schools, we go to libraries. I've met with a family at Walmart before. We meet families at visitation at county site buildings, community centers, their home, all kinds of places, because we know that families are most comfortable where they live and where they grow, and that's where we want to help them the most. We also have, sorry, go ahead.
I just had a quick question. You may have mentioned this and I missed it. So this for families with insurance, or is there a
Great question.
sliding scale for payment, or how does that go?
Thank you for asking that question. So we do primarily serve the Medicaid population. So if you have Medicaid, your services are completely covered. We do have some panel providers who can serve folks with private insurance. We also have a grant through Invest in Children, where we're able to provide services at no cost for the early childhood population. And so those could be children who either have private insurance or don't have insurance. And again, that's through local funding. And then we do have some other funding that covers some consultation in schools. So we serve 113 schools within Cuyahoga County. So if Ohio Guidestone is in one of those schools, then we are able to provide some groups that are free. We are able to provide some additional, like I said, consultation services. So typically like 6 sessions would be for free. And then we would work together with the families to refer to something that could meet their needs more long-term if needed.
Is there usually long wait lists to get services?
Great question. So it really depends. We typically do have a wait. How long it is really depends on the area that you're looking in. Our therapists and therapeutic behavioral service workers have geo-regions, so they serve the areas that are around them, sort of in pockets all over Cuyahoga County. And when they have openings, that's when we're able to fill their caseload with clients. So we have an early childhood wait list that's separate from our youth services wait list. I would say right now our early childhood wait list is probably around 4 to 6 weeks. But when we do have more emergent cases, the more information you can put on a referral, the better. We work hard to get those cases served as soon as we can.
Okay, thank you.
You're welcome. Any other questions? Here are other services. We do have an adult mental health program. We have maternal depression. We have an ACT team, assertive community treatment. We serve different families. We have foster care, we have parent coaching, we have substance use disorder programming, and we also have job training, Workforce 360, and community training programs. We also lead the following, the Institute of Family and Community Impact. We have research typically going on in terms of, Catherine mentioned a little bit about our Joyful Together initiative. We also have a Father's Feelings initiative where we screen for paternal mental health. We have care coordination services with Ohio Rise, and we have certified community behavioral health clinics as well. Clients can also come in and not just as mental health clients, but they can come in to our medical front door, which is psychiatry appointments first. So again, depending on what the client needs or the family needs, at intake, they would discuss the different options, and intake can help them figure out where they should start for services. We do have a variety of accreditations. We adhere to the highest possible standards to ensure better person-centered care for those that we serve. And then in order to make a referral, the best way is to visit us on our website, ohioguidestone.org. There is at the top of the page a little orange box that says request services. You can click on that and it pulls up a referral where you fill out all your information, and that goes right to our intake department. And from there, they may contact clients and parents and ask additional follow-up questions, and then they will place them on the correct waiting list. Our phone number is also on there. So another pathway could be while you are visiting with your families, you could have them call together to get services set up as well. And then my contact information is here, as well as Catherine's. If you have any specific questions, feel free to reach out to us. And that brings me to the end of our presentation. So if anyone has any additional questions, now would be a great time to chime in.
You can type something into the chat, say something.
Okay, while you're thinking, I just want to thank Catherine and Kaylin for their time and all the great information. And the one thing I didn't ask you each is, would you be able to share the PowerPoint?
Absolutely, yes.
Okay, if you can send it to me, I can get that out to everyone. This is recorded, so if there is something that you really wanted to share with a colleague, in the next week or so, you'll get an email saying that the recording is now available on our YouTube channel. I will send out at the same time the copy of the presentation in a PDF form so that you have that to view as well.
Thank you. Just really appreciate you all having us and you all contributing to this discussion.
And we greatly appreciate you. So with that, I can give everyone 7 minutes earlier to eat a sandwich before you have to go back to work.
Oh, Monica had a question. She's
Yeah,
asking
Monica.
me, yeah,
Okay,
since the wait is
okay.
4 to 6 weeks, do you refer to other agencies? Yes, we absolutely do. We utilize our early childhood mental health coordinator, Shauna Dewey, who is located at the Department of Children and Family Services. And she helps us connect families to other providers if needed. Typically, most of the agencies do have a wait. I believe it's around the same. But she would be the best person to ask about that. And we want children and families to get services as soon as possible. We don't care who provides them. So that's what's most important for us, is that people are getting their needs met. Great question. Anyone else?
All right. Well, thanks again, everyone, and have a great rest of your day.
We have another question.
Oh, every time I go to say thank you, I'll just keep saying thank you.
So Ohio Guidestone come out to agencies to present or get information out there. We would love to, absolutely. Feel free to send me an email and I'm happy to coordinate that with you. We actually have partnerships. We're going out to 5 Cuyahoga County libraries in the next couple of months where we're going to present at the Play, Learn, and Grow programs. So whenever we can get out in the community and shake the hands and kiss the babies, we love to. So please let us know.
All right, I'm gonna say thank you again.